Hello, I'm Jovio Thomas Naokuriayo, a public health professional with around 5-year experience of leading hospital quality improvement activities. So I'm pleased to share with you this quality improvement course, which will help you to improve your quality improvement skills required for standard quality of care. So I hope you enjoy it. So the objectives for this course, by the end of this course, we'll be able to clearly understand what quality and quality improvement mean, to understand the detailed meaning of quality of care, its causes, its effects on health systems, to understand why quality improvement is needed in healthcare facilities, to understand the processes involved in the quality of care at the levels of healthcare facility and at the department or units. The next objectives also include to describe the strategies required for effective quality improvement, to describe principles of quality improvement, and finally to describe quality improvement methods. So what do quality and quality improvement mean? The World Health Organization defined quality as the degree to which healthcare services are delivered to patients and associated with health outcomes desired by patients. Then quality improvement is then considered as an umbrella of systematic and continuous activities implemented to deliver healthcare services according to standards and improve patient outcomes. In other words, quality improvement is doing the right thing right the first time and doing it better the next time. So what are the dimensions of quality of care? To achieve the best health outcomes, the quality of care needs to be effective by, of course, delivering evidence-based interventions to patients in need of them. The quality of care needs to be safe by avoiding harm to patients. It needs to be centered around patients or people, or it has to be acceptable through the provision of care based on patients' needs and preferences. The quality of care also needs to be timely by providing the evidence-based interventions at the right time. It should be equitable through the delivery of evidence-based interventions to every patient without variability in quality standards. The quality of care should also be efficient by avoiding waste and by maximizing benefits within the available resources. Finally, the quality of care should be integrated by providing the full range of care services across different levels of health systems. The low quality of care means that the care delivered to patients is poor, and this poor quality of care may be characterized by, for instance, inaccurate or wrong diagnosis, unnecessary or inappropriate treatment provided to patients, and medication errors. This low quality of care then may lead to reduced work productivity, reduced safety to patients, reduced population trust in health systems, health facilities, and of course, healthcare professionals, substantive wasted expenditures for health facilities, families, of course, the families of patients, and health systems in general, and increase in disease morbidity, and of course, deaths that can be preventable. So what are the causes of low quality of care? Most of the causes underlying the low quality of care in our developing countries are not new to us. They usually include staff shortage and turnover, poor health infrastructure and equipment, disproportionate distribution of the available staff, frequent stock out of medications and supplies, weak management of health systems, poor interaction between clinicians and patients. Also, the low leadership involvement in the continuous quality improvement process is also another cause. Poor communication between staff and their supervisors. Other causes may also include low technical and quality improvement skills for staff of healthcare facilities, lack of consistency between health facility plans and the quality standards. Staff also may tend to pay attention to clinical documentation rather than quality of care delivery. There might also be resistance to quality improvement process, staff resistance, and of course the staff who usually aren't motivated due to high workload, low salaries, and low incentives. So why is quality improvement needed in healthcare facilities? This is because there is a growing attention to patient-centered care. The quality improvement is also needed, of course, to reduce healthcare-associated errors, to reduce inefficiencies across. In quality improvement, there are basic principles that underlie the quality improvement standards in healthcare facilities. These principles include health systems and processes, clients, team working, and data use. Systems and processes. Within the systems and the processes, the resources or inputs, in other words, the financial resources, human resources, and of course infrastructure and equipment, allow to perform processes such as patient admission and treatment to lead to health outcomes. So within the systems and the processes, resources or inputs, in other words, financial resources, human resources, and infrastructure, allow to perform processes such as patient admission, treatment to lead to health outcomes. Examples of outcomes may include improved health status of patients and their satisfaction. If systems and processes aren't appropriately functioning, there is a risk of having poor health outcomes for patients, such as worsening of their simple health conditions and dissatisfaction with their healthcare services. The next principle includes clients. There are two types of clients: internal clients and external clients. Internal clients, those are the clients who are already the health facility staff, including medical doctors, nurses, and the other staff. While the external clients are those mainly who are patients and other people who may visit the hospital or any health facilities for other purposes. So considering the perspectives of both types of clients can help to effectively design and implement quality improvement activities. Another principle is team working. The team working helps to achieve long-term and meaningful improvements within healthcare facility. This can also help to reduce we or they approach, but promote personal responsibility, because if someone is saying that they are working on it, it sounds like you are not involved in the process. So team working promotes personal responsibility within the quality improvement processes. It will also help to develop creativity and innovation, and of course to integrate quality principles into the organization's culture. The last principle is data use. Data use culture helps to identify a problem on time. For example, high rates of surgical site infections within health facility. It also helps to regularly collect data and analyze them to identify a recurrent problem, for example, high rates of surgical site infections every month. And of course, data use doesn't only help to identify a problem only, but also to understand root causes of the problem as well as solutions to address the problem. What strategies to consider when implementing a quality improvement process? The leaders need to prioritize a culture of learning and patient safety and have accountability for quality. Another strategy is to build team working, which needs to be a culture across the healthcare facilities. Incident reporting culture has to be made a culture by creating a blame-free environment. The health facility staff have to be continuously trained about quality improvement. Another strategy is that the quality of care needs to be integrated into the routine practice. Also, the leaders need to consider increasing staffing levels according to the workload, improving patients' awareness about quality of care, motivating staff through promotion opportunities, increase salaries, and of course, increase incentives upon achieving a better performance. All staff at all levels need to be actively involved in the quality improvement process. There is also a need for regular monitoring of compliance with the quality standards to allow leaders take a timely decision making and of course maintain achieved successes. So what is then the ideal process for implementing the continuous quality improvement within a healthcare facility? So what is the ideal process for implementing the continuous quality improvement within a healthcare facility? First, the health facility leaders need to embrace the concept and the value of continuous quality improvement. The second step is that the leaders have to communicate the concept and the value of quality improvement to all staff. Another step is that the leaders have to establish a structure of quality improvement. After this, the staff then are educated about the required standards of quality improvement and how they have to implement them. To be able to analyze the effectiveness of the quality improvement process, after a given period of time, a baseline assessment is then conducted. Then, the improvement work plans are developed based on gaps identified from the baseline assessment. The quality standards are continuously implemented through quality improvement activities. In other words, this implementation is integrated into the daily practice. Then, progress surveys are conducted by external surveyors, and these surveyors provide feedback to the health facility, and new work plans are developed to address identified gaps. Then final external accreditation survey is conducted where the decision of accrediting the health facility or not is taken. Then what is the ideal process for implementing the continuous quality improvement process within a department or a unit within a healthcare facility? For example, in case you are a department or unit head, you need to establish a culture for quality within your unit. If you are not the head, encourage others by setting quality as your cultural practice. Then identify ideas for improvement and prioritize them. Collect department data and analyze them. Then communicate the findings with your staff. Then have a commitment to ongoing improvement and monitoring. And if you have successes, you need to share them with the other units to encourage them. Quality improvement methods. In fact, there are different methods to improve quality in healthcare. Here, we discuss 3 methods, which are the most commonly used. These methods include 5S methods, focus, and PDSA. 5S methods stand for sort, set, shine, standardize, and sustain. Focus stands for find, organize, understand, and select. While PDSA stands for plan, do, study, or check, and act. So PDSA may also be called PDCA. The 5S methods helps to have a more efficient work environment, and this method is usually used for waste management, inventory management, etc. So the first S within the S method, 5S methods, stands for sort, which means to remove unused items for current work processes. The second S stands for set, which means to organize the useful items for an orderly way to make working processes easy. The third S stands for shine, which means to maintain high standard of cleanliness, of working environment, equipment, and tools. The fourth S stands for standardize, which means to set up the sort step, the set step, and shine step as the norms or standards in every health facility unit or department. The fifth S stands for sustain, which means to train the staff about the established standard and keep practicing the same standard. So having an example of the 5S method, methods, a departmental archive with medical files that are not organized. These files are disorganized in shelves and spread on the floor. There are also torn and old boxes all over the room. It is almost impossible to retrieve a patient medical file. So how can we implement this, or how can we apply these 5S methods? For example, within the 5S methods, the first S, which stands for sort, requires to remove all the old boxes as they are unused items. The second S, which stands for set, requires to organize the files in shelves according to patients' identification numbers. The third S, which stands for shine, requires to clean the room and ensure there is easy access to all medical files. The fourth S, which stands for standardize, requires to create a policy on how to organize medical files in the archive. And this policy is important as it provides directions on how to implement the changes to improve performance. The last S, which stands for sustain, requires to train the staff on how to organize the medical files according to the policy and keep monitoring compliance with the policy. Focus method. As mentioned in the previous slides, focus stands for find, organize, understand, and select. The focus method is used to identify areas for improvement. Within the focus, F, which stands for find, requires us to find a process to improve. We need to identify problems within different processes. Then the problems are prioritized based on the criteria of high risk, magnitude of the problem, and the volume of the problem. Thereafter, we need to select a problem within the high risk, magnitude, and the volume criteria. Or within the focus stands for organize, which requires to organize a team who have to address the problem. This team include members who are selected from those who are involved in the process. C, within the focus method, stands for clarify. So this requires to clarify steps for current process and design indicators to show performance. These steps helps to review current processes and policies, to identify the involved or affected people, to identify where the problem occurs within the process, to understand when the problem mostly occurs, and of course to understand the effects of the problem on the health facility or health system. U stands for understanding the process variation. In other words, factors which have led to the problem. At this step, you need to do a root cause analysis with the fishbone diagram to get details on the most likely causes at the root of the problem, the causes which can be improved to make the biggest positive impact. As you can see in this figure, when developing a fishbone diagram, the problem, which is also called effect, is placed at the head of the fish. So you need to make sure that the problem is clear and specific. Major causes category or primary root causes are written on the main branch bones. These cause categories are mainly related to environmental factors, people including staff or patients, policies or regulations, equipment and infrastructure. Then ask why the primary root causes happened and write all possible secondary causes on the branch originating from the appropriate primary cause categories. Then keep asking why each secondary cause happened to generate deeper levels of causes. So this is an example of a developed fishbone diagram where the identified problem was a high rate of surgical site infections or post-operative infections within a maternity department. To identify possible root causes that underlie the surgical site infections, interview was conducted with the concerned patients, staff from maternity department, operating rooms, infection prevention and control committee members and leaders. The sterilization, laundry, and waste management processes, clinical records, and the policies were also reviewed. An investigative observation was also done in the sterilization room, operating rooms, laundry, and patient care units. All the identified causes were presented in the fishbone diagram. Within the focus methods, S, which stands for select, requires to select an improvement strategy for solving the problem. The strategies should address the root causes, then state objectives of the solution based on intended outcomes, and then list all intervention options, and finally select the best interventions to address the root causes. PDSA cycle or PDCA cycle. As explained in the previous slides, PDSA stands for plan, do, study, or check, and act. The PDSA cycle is a never-ending cycle. The best interventions selected from the focus method are then implemented through the PDSA cycle. For plan within the PDSA cycle, there is a need for setting objectives for addressing the problem using the selected interventions and then develop a work plan. For do within the PDSA method, you need to implement the solutions planned, and for study or check, you need to collect and analyze data to assess if the intended objectives have been achieved or not. Finally, for act within the PDSA method, based on the analysis findings, you need to decide on how to keep implementing the innovations and make improvements to the interventions. As explained in the previous slides, the PDSA stands for plan, do, study or check, and act. The PDSA cycle is a never-ending cycle. The best interventions selected from the focus methods are then implemented through the PDSA cycle. For plan, there is a need for setting objectives for addressing the problem using the selected interventions and then develop a work plan. For do within the PDSA cycle, you need to implement the solutions planned. For study or check, you need to collect and analyze data to assess if the intended outcomes have been achieved or not. For act, based on the analysis findings, you need to decide on how to keep implementing the interventions and make improvements to the interventions. If you find that the implemented interventions were effective, you need to keep monitoring the implementation. If the interventions or some of them weren't effective, then you need to discuss why. For instance, you need to check if the interventions were adequately implemented, if the interventions were communicated to all the people who are concerned. Also check if the concerned staff were sufficiently trained on how to implement the change. Check if the resources required for implementing the change were available. Check if the concerned staff were committed and accountable for implementing the change, and so on. And then implement the PDSA cycle again based on the identified reasons. So, as a conclusion, there is a tremendous advancement of modern medicine across the world. However, there are still claims related to poor quality of healthcare services. So, applying the principles and methods of quality improvement can hugely improve the healthcare quality, client satisfaction, patient safety, and the health system in general. Thank you so much for following this course. So please read the additional resources by clicking on the below links. If you have any questions or need any assistance, please contact us at the below address. Thank you.